Hello everyone, and welcome. In today's Pearson NCLEX RN Practice Questions 199 Questions and Answers Practice session, we'll go through 199 updated questions designed to help you prepare for the exam. When each question appears, pause the video first. Choose the answer you believe is correct, then comment your answer below before resuming the video to see the correct answer. Keep track of your score as you move through the questions, and let's get started. Flashcard 1-2. A 30-year-old male from Haiti is brought to the emergency department in sickle cell crisis. What is the best position for this client? Sideline with knees flexed, knee chest high fowlers with knees flexed, semifowlers with legs extended on the bed. Pause and think of the answer before the reveal. The answer is semifowlers with legs extended on the bed. Flashcard 2-3. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? Taking hourly blood pressures with mechanical cuff, encouraging fluid intake of at least 200 milliliters per hour, position in high fowlers with knee gach raised, administering Tylenol as ordered. Pause and think of the answer before the reveal. The answer is encouraging fluid intake of at least 200 milliliters per hour. It is important to keep the client in sickle cell crisis hydrated to prevent further sickling of the blood. Flashcard 3-4. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? Peaches, cottage cheese, popsicle, lima beans. Pause and think of the answer before the reveal. The answer is popsicle. Hydration is important in the client with sickle cell disease to prevent thrombus formation. Popsicles, gelatin, juice, and pudding have high fluid content. Flashcard 4-5. A newly admitted client has sickle cell crisis. The nurse is planning care based on assessment of the client. The client is complaining of severe pain in his feet and hands. The pulse oximetry is 92. Which of the following interventions would be implemented first? Assume that there are orders for each intervention. Adjust the room temperature, give a bolus of IV fluids, start oxygen, administer meperidine Demerol 75 mg IV push. Pause and think of the answer before the reveal. The answer is start oxygen. The most prominent clinical manifestation of sickle cell crisis is pain. However, the pulse oximetry indicates that oxygen levels are low, thus oxygenation takes precedence over pain relief. Flashcard 5-6. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? Roast beef, gelatin salad, green beans, and peach pie, chicken salad sandwich, coleslaw, French fries, ice cream, egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie, pork chop, creamed potatoes, corn, and coconut cake. Pause and think of the answer before the reveal. The answer is egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie, egg yolks, wheat bread, carrots, raisins, and green, leafy vegetables are all high in iron, which is an important mineral for this client. Roast beef, cabbage, and pork chops are also high in iron, but the side dishes accompanying these choices are not. Flashcard 6-7. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? A family vacation in the Rocky Mountains, chaperoning the local boys club on a snow skiing trip, traveling by airplane for business trips, a bus trip to the Museum of Natural History. Pause and think of the answer before the reveal. The answer is a bus trip to the Museum of Natural History. A family vacation in the Rocky Mountains at high altitudes, cold temperatures, and airplane travel can cause sickling episodes and should be avoided. Flashcard 7-8. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which of the following would the nurse include in the physical assessment? Palpate the spleen, take the blood pressure, examine the feet for petechiae, examine the tongue. Pause and think of the answer before the reveal. The answer is examine the tongue. The tongue is smooth and beefy red in the client with vitamin B12 deficiency, so examining the tongue should be included in the physical assessment. Flashcard 8-9. An African-American female comes to the outpatient clinic. The physician suspects vitamin B12 deficiency anemia. Because jaundice is often a clinical manifestation of this type of anemia, what body part would be the best indicator? conjunctiva of the eye, soles of the feet, roof of the mouth, shins. Pause and think of the answer before the reveal. The answer is roof of the mouth. The oral mucosa and hard palate, roof of the mouth, are the best indicators of jaundice in dark-skinned persons. The conjunctiva can have normal deposits of fat, which give a yellowish hue, thus, answer A is incorrect. The soles of the feet can be yellow if they are calloused, making answer B incorrect. The shins would be an area of darker pigment. Flashcard 910. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? Blood pressure 146/88, respirations 28, shallow weight gain of 10 pounds in 6 months, pink complexion. Pause and think of the answer before the reveal. The answer is respirations 28, shallow. When there are fewer red blood cells, there is less hemoglobin and less oxygen. Therefore, the client is often short of breath. Flashcard 1011. The nurse is teaching the client with polycythemia vera about prevention of complications of the disease. Which of the following statements by the client indicates a need for further teaching? I will drink 500 milliliters of fluid or less each day. I will wear support hose when I am up. I will use an electric razor for shaving. I will eat foods low in iron. Pause and think of the answer before the reveal. The answer is I will drink 500 milliliters of fluid or less each day. The client with polycythemia vera is at risk for thrombus formation. Hydrating the client with at least 3 liters of fluid per day is important in preventing clot formation. Flashword 1112. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following would the nurse inquire about as a part of the assessment? The client collects stamps as a hobby. The client recently lost his job as a postal worker. The client had radiation for treatment of Hodgkin's disease as a teenager. The client's brother had leukemia as a child. Pause and think of the answer before the reveal. The answer is the client had radiation for treatment of Hodgkin's disease as a teenager. Radiation treatment for other types of cancer can result in leukemia. Some hobbies and occupations involving chemicals are linked to leukemia, but not the ones in these answers. Therefore, answers A and B are incorrect. Answer D is incorrect because the incidence of leukemia is higher in twins than in siblings. Flashcard 1213. An African-American client is admitted with acute leukemia. The nurse is assessing for signs and symptoms of bleeding. Where is the best site for examining for the presence of petechiae? The abdomen, the thorax, the earlobes, the soles of the feet. Pause and think of the answer before the reveal. The answer is the soles of the feet. Petechiae are not usually visualized on dark skin. The soles of the feet and palms of the hand provide a lighter surface for assessing the client for petechiae. Flashword 1314. A client with acute leukemia is admitted to the oncology unit. Which of the following would be most important for the nurse to inquire? Have you noticed a change in sleeping habits recently? Have you had a respiratory infection in the last 6 months? Have you lost weight recently? Have you noticed changes in your alertness? Pause and think of the answer before the reveal. The answer is, have you had a respiratory infection in the last 6 months? The client with leukemia is at risk for infection and has often had recurrent respiratory infections during the previous 6 months. Insomnolence, weight loss, and a decrease in alertness also occur in leukemia, but bleeding tendencies and infections are the primary clinical manifestations. Flashcard 1415. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? Oral mucous membrane, altered related to chemotherapy, risk for injury related to thrombocytopenia, fatigue related to the disease process, interrupted family processes related to life-threatening illness of a family member. Pause and think of the answer before the reveal. The answer is risk for injury related to thrombocytopenia. The client with acute leukemia has bleeding tendencies due to decreased platelet counts, and any injury would exacerbate the problem. The client would require close monitoring for hemorrhage, which is of higher priority. Flashcard 1516. A 21-year-old male with Hodgkin's lymphoma is a senior at the local university. He is engaged to be married and is to begin a new job upon graduation. Which of the following diagnoses would be a priority for this client? sexual dysfunction related to radiation therapy, anticipatory grieving related to terminal illness, tissue integrity related to prolonged bed rest, fatigue related to chemotherapy. Pause and think of the answer before the reveal. The answer is sexual dysfunction related to radiation therapy. Radiation therapy often causes sterility in male clients and would be of primary importance to this client. The psychosocial needs of the client are important to address in light of the age and life choices. Hodgkin's disease, however, has a good prognosis when diagnosed early. Flashcard 1617. A client has autoimmune thrombocytopenic purpura. To determine the client's response to treatment, the nurse would monitor platelet count, white blood cell count, potassium levels, partial prothrombin time, PTT. Pause and think of the answer before the reveal. The answer is platelet count. Clients with autoimmune thrombocytopenic purpura ATP have low platelet counts, making answer the correct answer. White cell counts, potassium levels, and PTT are not affected in ATP. Flashcard 1718. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura ATP. The client's platelet count currently is 80. It will be most important to teach the client and family about bleeding precautions, prevention of falls, oxygen therapy, conservation of energy. Pause and think of the answer before the reveal. The answer is bleeding precautions. The normal platelet count is 120,000 minus 400. Bleeding occurs in clients with low platelets. The priority is to prevent and minimize bleeding. Flashcard 1819. A client with a pituitary tumor has had a transfemoidal hypostectomy. Which of the following interventions would be appropriate for this client? Place the client in Trendelenburg position for postural drainage. Encourage coughing and deep breathing every 2 hours. Elevate the head of the bed 30 degrees. Encourage the Valsalva maneuver for bowel movements. Pause and think of the answer before the reveal. The answer is elevate the head of the bed 30 degrees. Elevating the head of the bed 30 degrees avoids pressure on the sellar tursicor and alleviates headaches. Answers A, B, and D are incorrect because Trendelenburg, Valsalva maneuver, and coughing all increase the intracranial pressure. Flashcard 1920. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention for this client is measure the urinary output, check the vital signs, encourage increased fluid intake, weigh the client. Pause and think of the answer before the reveal. The answer is check the vital signs. The large amount of fluid loss can cause fluid and electrolyte imbalance that should be corrected. The loss of electrolytes would be reflected in the vital signs. Measuring the urinary output is important, but the STEM already says that the client has polyuria, so answer is incorrect. Encouraging fluid intake will not correct the problem, making answer C incorrect. Flashcard 2021. A client with hemophilia has a nosebleed. Which nursing action is most appropriate to control the bleeding? Place the client in a sitting position with a head hyperextended. Pack the nose tightly with gauze to apply pressure to the source of bleeding. Pinch the soft lower part of the nose for a minimum of 5 minutes. Apply ice packs to the forehead and back of the neck. Pause and think of the answer before the reveal. The answer is pinch the soft lower part of the nose for a minimum of 5 minutes. The client should be positioned upright and leaning forward to prevent aspiration of blood. Answers A, B, and D are incorrect because direct pressure to the nose stops the bleeding, and ice packs should be applied directly to the nose as well. If a pack is necessary, the nares are loosely packed. Flashcard 2122. A client has had a unilateral adrenalectomy to remove a tumor. To prevent complications, the most important measurement in the immediate post-operative period for the nurse to take is blood pressure, temperature, output, specific gravity. Pause and think of the answer before the reveal. The answer is blood pressure. Blood pressure is the best indicator of cardiovascular collapse in the client who has had an adrenal gland removed. The remaining gland might have been suppressed due to the tumor activity. Temperature would be an indicator of infection. Decreased output would be a clinical manifestation, but would take longer to occur than blood pressure changes, and specific gravity changes occur with other disorders. Flashcard 22. A client with Addison's disease has been admitted with a history of nausea and vomiting for the past 3 days. The client is receiving IV glucocorticoids, Salmeterol. Which of the following interventions would the nurse implement? Glucometer readings as ordered, intake/output measurements, sodium and potassium levels, monitored daily weights. Pause and think of the answer before the reveal. The answer is glucometer readings as ordered. IV glucocorticoids raise the glucose levels and often require coverage with insulin. Answer B is not necessary at this time. Sodium and potassium levels would be monitored when the client is receiving mineral corticoids, and daily weights is unnecessary. Flashcard 2324. A client had a total thyroidectomy yesterday. The client is complaining of tingling around the mouth and in the fingers and toes. What would the nurse's next action be? Obtain a crash cart, check the calcium level, assess the dressing for drainage, assess the blood pressure for hypertension. Pause and think of the answer before the reveal. The answer is check the calcium level. The parathyroid glands are responsible for calcium production and can be damaged during a thyroidectomy. The tingling is due to low calcium levels. The crash cart would be needed in respiratory distress, but would not be the next action to take. Thus, answer A is incorrect. Hypertension occurs in thyroid storm, and the drainage would occur in hemorrhage. Flashcard 2425. A 32-year-old mother of 3 is brought to the clinic. Her pulse is 52. There is a weight gain of 30 pounds in 4 months, and the client is wearing 2 sweaters. The client is diagnosed with hypothyroidism. Which of the following nursing diagnoses is of highest priority? Impaired physical mobility related to decreased endurance, hypothermia R/T, decreased metabolic rate, disturbed thought processes R/T, interstitial edema, decreased cardiac output R/T, bradycardia. Pause and think of the answer before the reveal. The answer is decreased cardiac output R/T, bradycardia. The decrease in pulse can affect the cardiac output and lead to shock, which would take precedence. Flashcard 2526. The client presents to the clinic with a serum cholesterol of 275 mg/dl and is placed on rosuvastatin Crestor. Which instruction should be given to the client? Report muscle weakness to the physician. Allow 6 months for the drug to take effect. Take the medication with fruit juice. Ask the doctor to perform a complete blood count before starting the medication. Pause and think of the answer before the reveal. The answer is report muscle weakness to the physician. The client taking antilipidemics should be encouraged to report muscle weakness because this is a sign of rhabdomyocytis. The medication takes effect within 1 month of beginning therapy, so answer B is incorrect. The medication should be taken with water because fruit juice, particularly grapefruit, can decrease the effectiveness, making answer C incorrect. Liver function studies should be checked before beginning the medication, not after the fact. Flashcard 2627. The client is admitted to the hospital with hypertensive crises. Diazoxide hypostat is ordered. During administration, the nurse should utilize an infusion pump, check the blood glucose level, place the client in Trendelenburg position, cover the solution with foil. Pause and think of the answer before the reveal. The answer is check the blood glucose level. Hypostat is given IV push for hypertensive crises, but it often causes hyperglycemia. The glucose level will drop rapidly when stopped. Answer is incorrect because the hypostat is given by IV push. The client should be placed in dorsal recumbent position, not a Trendelenburg position, as stated in answer C. Answer D is incorrect because the medication does not have to be covered with foil. Flashcard 2729. The client admitted with angina is given a prescription for nitroglycerine. The client should be instructed to replenish his supply every 3 months, take one every 15 minutes. If pain occurs, leave the medication in the brown bottle, crush the medication, and take with water. Pause and think of the answer before the reveal. The answer is leave the medication in the brown bottle. Nitroglycerine should be kept in a brown bottle or even a special air and watertight, solid or plated silver or gold container because of its instability and tendency to become less potent when exposed to air, light, or water. The supply should be replenished every 6 months, not 3 months, and 1 tablet should be taken every 5 minutes until pain subsides, so answers A and B are incorrect. If the pain does not subside, the client should report to the emergency room. The medication should be taken sublingually and should not be crushed. Flashcard 2831. The client is admitted with left-sided congestive heart failure. In assessing the client for edema, the nurse should check the feet, neck, hands, sacrum, pause, and think of the answer before the reveal. The answer is neck. The jugular veins in the neck should be assessed for distension. The other parts of the body will be edematous in right-sided congestive heart failure, not left-sided. Flashcard 2932. The nurse is checking the client's central venous pressure. The nurse should place the zero of the manometer at the phlegbostatic axis PMI Erb's point tail of Spence. Pause and think of the answer before the reveal. The answer is substatic axis. The phlegbostatic axis is located at the fifth intercostal space mid-axillary line and is the correct placement of the manometer. The PMI, or point of maximal impulse, is located at the fifth intercostal space mid-clavicular line, so answer B is incorrect. Erb's point is the point at which you can hear the vowels close simultaneously, making answer C incorrect. The tail of Spence, the upper outer quadrant, is the area where most breast cancers are located and has nothing to do with placement of a manometer. Flashcard 3033. The physician orders lisinopril, zestril, and furosemide Lasix to be administered concomitantly to the client with hypertension. The nurse should question the order, administer the medications, administer separately, contact the pharmacy. Pause and think of the answer before the reveal. The answer is administer the medications. Zestril is an ACE inhibitor and is frequently given with a diuretic such as Lasix for hypertension. Flashcard 3134. The best method of evaluating the amount of peripheral edema is weighing the client daily, measuring the extremity, measuring the intake, and output, checking for pitting. Pause and think of the answer before the reveal. The answer is measuring the extremity. Flashcard 3235. A client with vaginal cancer is being treated with a radioactive vaginal implant. The client's husband asks the nurse if he can spend the night with his wife. The nurse should explain that overnight stays by family members is against hospital policy. There is no need for him to stay because staffing is adequate. His wife will rest much better knowing that he is at home. Visitation is limited to 30 minutes when the implant is in place. Pause and think of the answer before the reveal. The answer is visitation is limited to 30 minutes when the implant is in place. Clients with radium implants should have close contact limited to 30 minutes per visit. The general rule is limiting time spent exposed to radium, putting distance between people and the radium source, and using lead to shield against the radium. Teaching the family member these principles is extremely important. Flashcard 3337. The physician has prescribed Novolog insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the peak action of the insulin occurs? I will make sure I eat breakfast within 10 minutes of taking my insulin. I will need to carry candy or some form of sugar with me all the time. I will eat a snack around 3 o'clock each afternoon. I can save my dessert from supper for a bedtime snack. Pause and think of the answer before the reveal. The answer is I will make sure I eat breakfast within 10 minutes of taking my insulin. Novolog insulin onsets very quickly, so food should be available within 10 to 15 minutes of taking the insulin. Answer B does not address a particular type of insulin, so it is incorrect. NPH insulin peaks in 8 minutes, 12 hours, so a snack should be eaten at the expected peak time. It may not be 3 p.m. as stated in answer C. Answer D is incorrect because there is no need to save the dessert until bedtime. Flashcard 3438. The nurse is teaching basic infant care to a group of first-time parents. The nurse should explain that a sponge bath is recommended for the first 2 weeks of life because new parents need time to learn how to hold the baby. The umbilical cord needs time to separate. Newborn skin is easily traumatized by washing. The chance of chilling the baby outweighs the benefits of bathing. Pause and think of the answer before the reveal. The answer is the umbilical cord needs time to separate. The umbilical cord needs time to dry and fall off before putting the infant in the tub. Flashcard 3539. A client with leukemia is receiving trinidixate. After reviewing the client's chart, the physician orders leucovorin calcium. The rationale for administering leucovorin calcium to a client receiving trinidixate is to treat iron deficiency anemia caused by chemotherapeutic agents, create a synergistic effect that shortens treatment time, increase the number of circulating neutrophils, reverse drug toxicity, and prevent tissue damage. Pause and think of the answer before the reveal. The answer is reverse drug toxicity and prevent tissue damage. Leucovorin is the antidote for methotrexate and trimethoxate, which are folic acid antagonists. Leucovorin is a folic acid derivative. Flashcard 3640. A 4-month-old is brought to the Well Baby Clinic for immunization. In addition to the DPT and polio vaccines, the baby should receive Hib titer mumps vaccine, hepatitis B vaccine, MMR. Pause and think of the answer before the reveal. The answer is Hib titer. The Haemophilus influenza vaccine is given at 4 months with the polio vaccine. Flashcard 3741. The physician has prescribed Nexium-esomeprazole for a client with erosive gastritis. The nurse should administer the medication 30 minutes before meals, with each meal in a single dose, at bedtime 30 minutes after meals. Pause and think of the answer before the reveal. The answer is 30 minutes before meals. Proton pump inhibitors reduce the production of acid in the stomach. Proton pump inhibitors such as Nexium and Protonix work best when they are taken 30 minutes before the first meal of the day. Flashcard 3842. A client on the psychiatric unit is in an uncontrolled rage and is threatening other clients and staff. What is the most appropriate action for the nurse to take? Call security for assistance and prepare to sedate the client. Tell the client to calm down and ask him if he would like to play cards. Tell the client that if he continues his behavior, he will be punished. Leave the client alone until he calms down. Pause and think of the answer before the reveal. The answer is call security for assistance and prepare to sedate the client. If the client is a threat to the staff and to other clients, the nurse should call for help and prepare to administer a medication such as Haldol to sedate him. Flashcard 3943. When the nurse checks the fundus of a client on the first postpartum day, she notes that the fundus is firm, is at the level of the umbilicus, and is displaced to the right. The next action the nurse should take is to check the client for bladder distension, assess the blood pressure for hypotension, determine whether an oxytocic drug was given, check for the expulsion of small clots. Pause and think of the answer before the reveal. The answer is check the client for bladder distension. If the fundus of the client is displaced to the side, this might indicate a full bladder. Flashcard 4044. A client is admitted to the hospital with a temperature of 99.8 degrees Fahrenheit, complaints of blood-tinged hemoptysis, fatigue, and night sweats. The client's symptoms are consistent with the diagnosis of a pneumonia reaction to antiviral medication, tuberculosis, superinfection due to low CD4 count. Pause and think of the answer before the reveal. The answer is tuberculosis. A low-grade temperature, blood-tinged sputum, fatigue, and night sweats are symptoms consistent with tuberculosis. If the answer in a had said pneumocystis, pneumonia answer would have been consistent with the symptoms given in the stem, but just saying pneumonia isn't specific enough to diagnose the problem. Flashcard 4145. The client is seen in the clinic for treatment of migraine headaches. The drug Imitrex sumatriptan succinate is prescribed for the client. Which of the following in the client's history should be reported to the doctor? Diabetes, Prince metals, angina, cancer, cluster headaches. Pause and think of the answer before the reveal. The answer is Prince metals, angina. If the client has a history of Prince metals, angina, he should not be prescribed triptan preparations because they cause vasoconstriction and coronary spasms. There is no contraindication for taking triptan drugs in clients with diabetes, cancer, or cluster headaches. Flashcard 4246. The client with suspected meningitis is admitted to the unit. The doctor is performing an assessment to determine meningeal irritation and spinal nerve route inflammation. A positive Kernig's sign is charted if the nurse notes pain on flexion of the hip and enuncial rigidity on flexion of the neck, pain when the head is turned to the left side, dizziness when changing positions. Pause and think of the answer before the reveal. The answer is pain on flexion of the hip and knee. Kernig's sign is positive if pain occurs on flexion of the hip and knee. The Brzezinski reflex is positive if pain occurs on flexion of the head and neck onto the chest. Flashcard 4347. The client with Alzheimer's disease is being assisted with activities of daily living when the nurse notes that the client uses her toothbrush to brush her hair. The nurse is aware that the client is exhibiting agnosia, apraxia, anomia, aphasia. Pause and think of the answer before the reveal. The answer is apraxia. Apraxia is the inability to use objects appropriately. Agnosia is loss of sensory comprehension. Anomia is the inability to find words. Aphasia is the inability to speak or understand. Flashcard 4450. The doctor has prescribed Exelin rivastigmine for the client with Alzheimer's disease. Which side effect is most often associated with this drug? Urinary incontinence, headaches, confusion, nausea. Pause and think of the answer before the reveal. The answer is nausea. Nausea and gastrointestinal upset are very common in clients taking acetylcholinesterase inhibitors such as Exelin. Other side effects include liver toxicity, dizziness, unsteadiness, and clumsiness. The client might already be experiencing urinary incontinence or headaches, but they are not necessarily associated, and the client with Alzheimer's disease is already confused. Flashcard 4551. A client is admitted to the labor and delivery unit in active labor. During examination, the nurse notes a papular lesion on the perineum. Which initial action is most appropriate? Document the finding, report the finding to the doctor, prepare the client for a C-section, continue primary care as prescribed. Pause and think of the answer before the reveal. The answer is report the finding to the doctor. Any lesion should be reported to the doctor. This can indicate a herpes lesion. Clients with open lesions related to herpes are delivered by cesarean section because there is a possibility of transmission of the infection to the fetus with direct contact to lesions. The physician must make the decision to perform a C-section, making answer C incorrect. Flashcard 4653. During the initial interview, the client reports that she has a lesion on the perineum. Further investigation reveals a small blister on the vulva that is painful to touch. The nurse is aware that the most likely source of the lesion is syphilis, herpes, gonorrhea, candida mortar. Pause and think of the answer before the reveal. The answer is herpes. A lesion that is painful is most likely a herpetic lesion. A chancre lesion associated with syphilis is not painful. Candida mortar lesions are painless warts. Gonorrhea does not present as a lesion, but is exhibited by yellow discharge. Flashcard 4754. A client visiting a family planning clinic is suspected of having an STI. The best diagnostic test for treponema or pallidum is venereal disease. Research lab VDRL, rapid plasma region RPR, fluorescent treponemal antibody FTA, Thamartin culture TMC. Pause and think of the answer before the reveal. The answer is fluorescent treponemal antibody FTA. Fluorescent treponemal antibody FTA is the test for treponema or pallidum. VDRL and RPR are screening tests done for syphilis. The Thamartin culture is done for gonorrhea. Flashcard 4855. A 15-year-old primigravitor is admitted with a tentative diagnosis of HELLP syndrome. Which laboratory finding is associated with HELLP syndrome? Elevated blood glucose, elevated platelet count, elevated creatinine clearance, elevated hepatic enzymes. Pause and think of the answer before the reveal. The answer is elevated hepatic enzymes. The criteria for HELLP is hemolysis, elevated liver enzymes, low platelet count. Flashcard 4956. The nurse is assessing the deep tendon reflexes of a client with preeclampsia. Which method is used to elicit the biceps reflex? The nurse places her thumb on the muscle inset in the antecubital space and taps the thumb briskly with a reflex hammer. The nurse loosely suspends the client's arm in an open hand while tapping the back of the client's elbow. The nurse instructs the client to dangle her legs as the nurse strikes the area below the patellar with the blunt side of the reflex hammer. The nurse instructs the client to place her arms loosely at her side as the nurse strikes the muscle insert just above the wrist. Pause and think of the answer before the reveal. The answer is the nurse places her thumb on the muscle inset in the antecubital space and taps the thumb briskly with a reflex hammer. The nurse loosely suspends the client's arm in an open hand while tapping the back of the client's elbow elicits the triceps reflex. The nurse instructs the client to dangle her legs as the nurse strikes the area below the patellar with the blunt side of the reflex hammer elicits the patellar reflex. The nurse instructs the client to place her arms loosely at her side as the nurse strikes the muscle insert just above the wrist elicits the radial nerve. Flashcard 5057. A primigravida with diabetes is admitted to the labor and delivery unit at 34 weeks gestation. Which doctor's order should the nurse question? Magnesium sulfate 4 gm 25% IV breathine 10 micrograms, IV Statal 1 milligrams, IV push every 4 hours as needed for pain ANSEF 2 gm every 6 hours. Pause and think of the answer before the reveal. The answer is breathine 10 micrograms IV. Breathine is used cautiously because it raises the blood glucose levels. Magnesium sulfate 4 gm 25% IV, Statal 1 milligrams IV, and ANSEF 2 gm IP are all medications that are commonly used in the diabetic client. Flashcard 5158. A diabetic multigravida is scheduled for an amniocentesis at 32 weeks gestation to determine the L/S ratio and phosphatidylglycerol level. The L/S ratio is 1:1, and the presence of phosphatidylglycerol is noted. The nurse's assessment of this data is the infant is at low risk for congenital anomalies. The infant is at high risk for intrauterine growth retardation. The infant is at high risk for respiratory distress syndrome. The infant is at high risk for birth trauma. Pause and think of the answer before the reveal. The answer is the infant is at high risk for respiratory distress syndrome. When the L/S ratio reaches 2:1, the lungs are considered to be mature. The infant will most likely be small for gestational age and will not be at risk for birth trauma. The L/S ratio does not indicate congenital anomalies, and the infant is not at risk for intrauterine growth retardation. Flashcard 5260. The nurse caring for a client receiving intravenous magnesium sulfate must closely observe for side effects associated with drug therapy. An expected side effect of magnesium sulfate is decreased urinary output, hypersomnolence, absence of knee-jerk reflex, decreased respiratory rate. Pause and think of the answer before the reveal. The answer is hypersomnolence. The client is expected to become sleepy, have agitated flashes, and be lethargic. A decreasing urinary output, absence of the knee-jerk reflex, and decreased respirations indicate toxicity. Flashcard 5361. The client has elected to have epidural anesthesia to relieve labor pain. If the client experiences hypotension, the nurse would place her in Trendelenburg position, decrease the rate of IV infusion, administer oxygen per nasal cannula, increase the rate of the IV infusion. Pause and think of the answer before the reveal. The answer is increase the rate of the IV infusion. If the client experiences hypotension after an injection of epidural anesthetic, the nurse should turn her to the left side, apply oxygen by mask, and speed the IV infusion. If the blood pressure does not return to normal, the physician should be contacted. Epinephrine should be kept for emergency administration. Answer is incorrect because placing the client in Trendelenburg position head down will allow the anesthesia to move up above the respiratory center, thereby decreasing the diaphragm's ability to move up and down and ventilate the client. The IV rate should be increased, not decreased. In administering oxygen, the oxygen should be applied by mask, not cannula. Flashcard 5462. A client has cancer of the pancreas. The nurse should be most concerned about which nursing diagnosis: alteration in nutrition, alteration in bowel elimination, alteration in skin integrity in affected individual coping. Pause and think of the answer before the reveal. The answer is alteration in nutrition. Cancer of the pancreas frequently leads to severe nausea and vomiting and altered nutrition. Flashcard 5563. The nurse is caring for a client with ascites. Which is the best method to use for determining early ascites? Inspection of the abdomen for enlargement by manual palpation for hepatomegaly, daily measurement of abdominal girth, assessment for a fluid wave. Pause and think of the answer before the reveal. The answer is daily measurement of abdominal girth. Flashcard 5664. The client arrives in the emergency department after a motor vehicle accident. Nursing assessment findings include blood pressure 80/34, pulse rate 120, and respirations 20, which is the client's most appropriate priority nursing diagnosis. Alteration in cerebral tissue perfusion fluid volume, deficit in effective airway clearance, alteration in sensory perception. Pause and think of the answer before the reveal. The answer is fluid volume deficit. Flashcard 5765. A home health nurse is visiting an 18-year-old with osteogenesis imperfecta. Which information obtained on the visit would cause the most concern? The client likes to play football, drinks several carbonated drinks per day, has 2 sisters with sickle cell trait, is taking acetaminophen to control pain. Pause and think of the answer before the reveal. The answer is likes to play football. The client with osteogenesis imperfecta is at risk for pathological fractures and is likely to experience these fractures if he participates in contact sports. The client might experience symptoms of hypoxia if he becomes dehydrated or deoxygenated. Extreme exercise, especially in warm weather, can exacerbate the condition. Flashcard 5866. The nurse working the organ transplant unit is caring for a client with a white blood cell count of during evening visitation. A visitor brings a basket of fruit. What action should the nurse take? Allow the client to keep the fruit. Place the fruit next to the bed for easy access. But the client offer to wash the fruit for the client. Tell the family members to take the fruit home. Pause and think of the answer before the reveal. The answer is tell the family members to take the fruit home. Flashcard 5967. The nurse is caring for the client following a laryngectomy when suddenly the client becomes non-responsive and pale with a blood pressure of 90/40 systolic. The initial nurse's action should be to place the client in Trendelenburg position, increase the infusion of dextrose in normal saline, administer atropine intravenously, move the emergency cart to the bedside. Pause and think of the answer before the reveal. The answer is increase the infusion of dextrose in normal saline. In clients who have not had surgery to the face or neck, the answer would be placing the client in Trendelenburg position. However, in this situation, this could further interfere with the airway. Increasing the infusion and placing the client in supine position would be better. Administering atropine intravenously is incorrect because it is not necessary at this time and could cause hyponatremia and further hypotension. Flashcard 6069. A client being treated with sodium warfarin has a prop time of 120 seconds. Which intervention would be most important to include in the nursing care plan? Assess for signs of abnormal bleeding, anticipate an increase in the Coumadin dosage, instruct the client regarding the drug therapy, increase the frequency of neurological assessments. Pause and think of the answer before the reveal. The answer is assess for signs of abnormal bleeding. The normal prop time is 12 minutes 20 seconds. A prop time of 120 seconds indicates an extremely prolonged prop time and can result in a spontaneous bleeding episode. Flashcard 6171. The client with preeclampsia is admitted to the unit with an order for magnesium sulfate. Which action by the nurse indicates understanding of the possible side effects of magnesium sulfate? The nurse places a sign over the bed not to check blood pressure in the right arm. The nurse places a padded tongue blade at the bedside. The nurse inserts a Foley catheter. The nurse darkens the room. Pause and think of the answer before the reveal. The answer is the nurse inserts a Foley catheter. The client receiving magnesium sulfate should have a Foley catheter in place. An hourly intake and output should be checked. Flashcard 6272. A 6-year-old client is admitted to the unit with a hemoglobin of 6 grams/dl. The physician has written an order to transfuse 2 units of whole blood. When discussing the treatment, the child's mother tells the nurse that she does not believe in having blood transfusions and that she will not allow her child to have the treatment. What nursing action is most appropriate? Ask the mother to leave while the blood transfusion is in progress. Encourage the mother to reconsider. Explain the consequences without treatment. Notify the physician of the mother's refusal. Pause and think of the answer before the reveal. The answer is notify the physician of the mother's refusal. If the client's mother refuses the blood transfusion, the doctor should be notified. Because the client is a minor, the court might order treatment. Flashcard 6373. A client is admitted to the unit 2 hours after an explosion causes burns to the face. The nurse would be most concerned with the client developing which of the following: hypopholemia, laryngeal edema, hyponatremia, or hypokalemia. Pause and think of the answer before the reveal. The answer is laryngeal edema. The nurse should be most concerned with laryngeal edema because of the area of burn. The next priority should be answer A, as well as hyponatremia and hypokalemia. Flashcard 6474. The nurse is evaluating nutritional outcomes for an elderly client with bulimia. Which data best indicates that the plan of care is effective? The client selects a balanced diet from the menu. The client's hemoglobin and hematocrit improve. The client's tissue turgor improves. The client gains weight. Pause and think of the answer before the reveal. The answer is the client gains weight. Flashcard 6575. The client is admitted following repair of a fractured tibia and cast application. Which nursing assessment should be reported to the doctor? Pain beneath the cast, warm toes, pedal pulses, weak and rapid paresthesia of the toes. Pause and think of the answer before the reveal. The answer is paresthesia of the toes. At this time, pain beneath the cast is normal. The client's toes should be warm to the touch and pulses should be present. Paresthesia is not normal and might indicate compartment syndrome. Flashcard 6676. The client is having an arteriogram. During the procedure, the client tells the nurse, "I'm feeling really shitty." Which response would be best? "You are having an allergic reaction. I will get an order for Benadryl." That feeling of warmth is normal when the dye is injected. That feeling of warmth indicates that the clots in the coronary vessels are dissolving. I will tell your doctor and let him explain to you the reason for the hot feeling that you were experiencing. Pause and think of the answer before the reveal. The answer is that feeling of warmth is normal when the dye is injected. Flashcard 6777. The nurse is observing several healthcare workers providing care. Which action by the healthcare worker indicates a need for further teaching? The nursing assistant wears gloves while giving the client a bath. The nurse wears goggles while drawing blood from the client. The doctor washes his hands before examining the client. The nurse wears gloves to take the client's vital signs. Pause and think of the answer before the reveal. The answer is the nurse wears gloves to take the client's vital signs. It is not necessary to wear gloves to take the vital signs of the client. If the client has active infection with methicillin-resistant Staphylococcus aureus, gloves should be worn. Flashcard 6878. The client is having electroconvulsive therapy for treatment of severe depression. Which to the following indicates that the client's ECT has been effective? The client loses consciousness. The client vomits. The client's ECG indicates tachycardia. The client has a grand mal seizure. Pause and think of the answer before the reveal. The answer is the client has a grand mal seizure. During ECT, the client will have a grand mal seize. This indicates completion of the electroconvulsive therapy. Flashcard 6979. The 5-year-old is being tested for Enterobiarsis pinworms. To collect a specimen for assessment of pinworms, the nurse should teach the mother to examine the perineal area with a flashlight 2 or 3 hours after the child is asleep. Scrape the skin with a piece of cardboard and bring it to the clinic. Obtain a stool specimen. In the afternoon, bring a hair sample to the clinic for evaluation. Pause and think of the answer before the reveal. The answer is examine the perineal area with a flashlight 2 or 3 hours after the child is asleep. Infection with pinworms begins when the eggs are ingested or inhaled. The eggs hatch in the upper intestine and mature in 2-8 weeks. The females then mate and migrate out the anus, where they lay up to 17,000 eggs. This causes intense itching. The mother should be told to use a flashlight to examine the rectal area about 2-3 hours after the child is asleep. Placing clear tape on a tongue blade will allow the eggs to adhere to the tape. The specimen should then be brought in to be evaluated. Flashcard 7080. The nurse is teaching the mother regarding treatment for Enterobiarsis. Which instruction should be given regarding the medication? Treatment is not recommended for children less than 10 years of age. The entire family should be treated. Medication therapy will continue for 1 year. Intravenous antibiotic therapy will be ordered. Pause and think of the answer before the reveal. The answer is, the entire family should be treated. Arterobiarces, or pinworms, is treated with vermox, mebendazole, or antimonth parenteral pamode. The entire family should be treated to ensure that no eggs remain. Because a single treatment is usually sufficient, there is usually good compliance. The family should then be tested again in 2 weeks to ensure that no eggs remain. Flashcard 7181. The registered nurse is making assignments for the day. Which client should be assigned to the pregnant nurse? The client receiving linear accelerator radiation therapy for lung cancer, the client with a radium implant; for cervical cancer, the client who has just been administered soluble brachytherapy; for thyroid cancer, the client returned from placement of iridium seeds; for prostate cancer. Pause and think of the answer before the reveal. The answer is, the client receiving linear accelerator radiation therapy for lung cancer. The client receiving linear accelerator therapy travels to the radium department for therapy. The radiation stays in the department, so the client is not radioactive. The client and other answer choices pose a risk to the pregnant nurse. These clients are radioactive in very small doses, especially upon returning from the procedures. For approximately 72 hours, the clients should dispose of urine and feces in special containers and use plastic spoons and forks. Flashword 7282. The nurse is planning room assignments for the day. Which client should be assigned to a private room if only one is available? The client with Cushing's disease, the client with diabetes, the client with acromegaly, the client with myxedema. Pause and think of the answer before the reveal. The answer is, the client with Cushing's disease. The client with Cushing's disease has adrenocortical hypersecretion. This increase in the level of cortisone causes the client to be immune suppressed. In client with diabetes, the client poses no risk to other clients. The client with acromegaly has an increase in growth hormone and poses no risk to himself or others. The client with myxedema has hypothyroidism or myxedema and poses no risk to others or himself. Flashcard 7386. Which nurse should be assigned to care for the postpartum client with preeclampsia? The RN with 2 weeks of experience in postpartum, the RN with 3 years of experience in labor and delivery, the RN with 10 years of experience in surgery, the RN with 1 year of experience in the neonatal intensive care unit. Pause and think of the answer before the reveal. The answer is, the RN with 3 years of experience in labor and delivery. Flashcard 7487. Which information should be reported to the State Board of Nursing? The facility fails to provide literature in both Spanish and English. The narcotic count has been incorrect on the unit for the past 3 days. The client fails to receive an itemized account of his bills and services received during his hospital stay. The nursing assistant assigned to the client with hepatitis fails to feed the client and give the bath. Pause and think of the answer before the reveal. The answer is, the narcotic count has been incorrect on the unit for the past 3 days. The Joint Commission on Accreditation of Hospitals will probably be interested in the problems if facility fails to provide literature in both Spanish and English, and if the client fails to receive an itemized account of his bills and services received during his hospital stay. The failure of the nursing assistant to care for the client with hepatitis might result in termination, but is not of interest to the Joint Commission. Flashcard 7588. The nurse is suspected of charting medication administration that he did not give. After talking to the nurse, the charge nurse should call Board of Nursing, file a formal reprimand, terminate the nurse, charge the nurse with a taunt. Pause and think of the answer before the reveal. The answer is, file a formal reprimand. Flashcard 7694. Which instruction should be given to the client who is fitted for a behind-the-ear hearing aid? Remove the mold and clean every week. Store the hearing aid in a warm place. Clean the lint from the hearing aid with a toothpick. Change the batteries weekly. Pause and think of the answer before the reveal. The answer is, store the hearing aid in a warm place. The hearing aid should be stored in a warm, dry place. It should be cleaned daily, but should not be moldy, so removing the mold and clean every week is incorrect. A toothpick is inappropriate to use to clean the aid. The toothpick might break off in the hearing aid. Changing the batteries weekly is not necessary. Flashcard 7796. A client with bacterial pneumonia is admitted to the pediatric unit. What would the nurse expect the admitting assessment to reveal? High fever, non-productive cough, rhinitis, vomiting, and diarrhea. Pause and think of the answer before the reveal. The answer is I. If the child has bacterial pneumonia, a high fever is usually present. Bacterial pneumonia usually presents with a productive cough. Rhinitis is often seen with viral pneumonia, and vomiting and diarrhea are usually not seen with pneumonia. Flashword 7897. The nurse is caring for a client admitted with epiglottis. Because of the possibility of complete obstruction of the airway, which of the following should the nurse have available? Intravenous access supplies a tracheostomy set. Intravenous fluid administration pumps supplemental oxygen. Pause and think of the answer before the reveal. The answer is a tracheostomy set. Flashword 7999. The nurse is providing dietary instructions to the mother of an 8-year-old child diagnosed with celiac disease. Which of the following foods, if selected by the mother, would indicate her understanding of the dietary instructions? A ham sandwich on whole wheat toast, spaghetti and meatballs, hamburger with ketchup, cheese omelet. Pause and think of the answer before the reveal. The answer is cheese omelet. The child with celiac disease should be on a gluten-free diet. Ham sandwich on whole wheat toast, spaghetti and meatballs, and hamburger with ketchup all contain gluten, while answer cheese omelet gives the only choice of foods that does not contain gluten. Flashword 8101. A gravitor from 3 para 0 is admitted to the labor and delivery unit. The doctor performs an amniotomy. Which observation would the nurse be expected to make after the amniotomy? Fetal heart tones 160 beats per minute, a moderate amount of straw-colored fluid, a small amount of greenish fluid, a small segment of the umbilical cord. Pause and think of the answer before the reveal. The answer is a moderate amount of straw-colored fluid. An amniotomy is an artificial rupture of membranes, and normal amniotic fluid is straw-colored and odorless. Fetal heart tones of 160 indicate tachycardia, and greenish fluid is indicative of meconium, so answers A and C are incorrect. If the nurse notes the umbilical cord, the client is experiencing a prolapsed cord. Flashword 81102. The client is admitted to the unit. A vaginal exam reveals that she is 2 centimeters dilated. Which of the following statements would the nurse expect her to make? We have a name picked out for the baby. I need to push when I have a contraction. I can't concentrate if anyone is touching me. When can I get my epidural? Pause and think of the answer before the reveal. The answer is, when can I get my epidural? C indicates the end of the first stage of labor. Flashword 82103. The client is having fetal heart rates of 90 to 110 beats per minute during the contractions. The first action the nurse should take is reposition the monitor, turn the client to her left side, ask the client to ambulate, prepare the client for delivery. Pause and think of the answer before the reveal. The answer is, turn the client to her left side. The normal fetal heart rate is 120 to 160 beats per minute. 100 to 110 beats per minute is bradycardia. The first action would be to turn the client to the left side and apply oxygen. Flashword 83104. In evaluating the effectiveness of IV Pearson for a client with secondary dystocia, the nurse should expect a painless delivery, cervical effacement, infrequent contractions, progressive cervical dilation. Pause and think of the answer before the reveal. The answer is progressive cervical dilation. The expected effect of Pearson is cervical dilation. Pearson causes more intense contractions, which can increase the pain, making answer A incorrect. Cervical effacement is caused by pressure on the presenting part, so answer B is incorrect. Answer C is opposite the action of Pearson. Flashword 84105. A vaginal exam reveals a full-length breech presentation. The nurse should take which of the following actions at this time? Anticipate the need for a cesarean section. Apply the fetal heart monitor, place the client in genupectoral position, perform an ultrasound exam. Pause and think of the answer before the reveal. The answer is, apply the fetal heart monitor. No need for genupectoral position, knee chest. Flashword 85106. A vaginal exam reveals that the cervix is 4 centimeters dilated, with intact membranes and a fetal heart tone rate of 160 to 170 beats per minute. The nurse decides to apply an external fetal monitor. The rationale for this implementation is the cervix is closed. The membranes are still intact. The fetal heart tones are within normal limits. The contractions are intense enough for insertion of an internal monitor. Pause and think of the answer before the reveal. The answer is, the membranes are still intact. The cervix is dilated enough to use an internal monitor if necessary. An internal monitor can be applied if the client is at 0 station. Contraction intensity has no bearing on the application of the fetal monitor. Flashcard 86-107. The following are all nursing diagnoses appropriate for a gravidator 1 para 0 inches labor. Which one would be most appropriate for the primary gravidator as she completes the early phase of labor? Impaired gas exchange related to hyperventilation, alteration in placental perfusion related to maternal position, impaired physical mobility related to fetal monitoring equipment, potential fluid volume deficit related to decreased fluid intake. Pause and think of the answer before the reveal. The answer is potential fluid volume deficit related to decreased fluid intake. Clients admitted in labor are told not to eat during labor to avoid nausea and vomiting. Ice chips may be allowed, but this amount of fluid might not be sufficient to prevent fluid volume deficit. In answer, impaired gas exchange related to hyperventilation would be indicated during the transition phase. Flashcard 87-108. As the client reaches 8 centimeters dilation, the nurse notes late decelerations on the fetal monitor. The FHR baseline is 165 to 175 beats per minute with variability of 0 to 2 beats per minute. What is the most likely explanation of this pattern? The baby is asleep. The umbilical cord is compressed. There is a vagal response. There's uteroplacental insufficiency. Pause and think of the answer before the reveal. The answer is, there is uteroplacental insufficiency. This information indicates a late deceleration. This type of deceleration is caused by uteroplacental lack of oxygen. B results in a variable deceleration. C is indicative of an early deceleration. Flashcard 88-109. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to notify her doctor, start an IV, reposition the client, readjust the monitor. Pause and think of the answer before the reveal. The answer is, reposition the client. The initial action by the nurse observing a late deceleration should turn the client to the side, preferably the left side. Administering oxygen is also indicated. Variable decelerations equals umbilical cord is compressed. Flashcard 89-110. Which of the following is a characteristic of a reassuring fetal heart rate pattern? A fetal heart rate of 170 to 180 beats per minute, a baseline variability of 25 to 35 beats per minute, ominous, periodic changes, acceleration of FHR with fetal movements. Pause and think of the answer before the reveal. The answer is acceleration of FHR with fetal movements. Flashcard 90-111. The rationale for inserting a French catheter every hour for the client with epidural anesthesia is the bladder fills more rapidly because of the medication used for the epidural. Her level of consciousness is such that she is in a trance-like state. The sensation of the bladder filling is diminished or lost. She is embarrassed to ask for the bed attendant frequently. Pause and think of the answer before the reveal. The answer is, the sensation of the bladder filling is diminished or lost. Epidural anesthesia decreases the urge to void and sensation of a full bladder. A full bladder will decrease the progression of labor. Flashcard 91-112. A client in the family planning clinic asks the nurse about the most likely time for her to conceive. The nurse explains that conception is most likely to occur when estrogen levels are low, luteinizing hormone is high, the endometrial lining is thin, the progesterone level is low. Pause and think of the answer before the reveal. The answer is, luteinizing hormone is high. Luteinizing hormone released by the pituitary is responsible for ovulation. At about day 14, the continued increase in estrogen stimulates the release of luteinizing hormone from the anterior pituitary. The LH surge is responsible for ovulation. or the release of the dominant follicle in preparation for conception, which occurs within the next 10 minutes, 12 hours after the LH levels peak? Answers A, C, and D are incorrect. Because estrogen levels are high at the beginning of ovulation, the endometrial lining is thick, not thin, and the progesterone levels are high, not low. Flashcard 92-113. A client tells the nurse that she plans to use the rhythm method of birth control. The nurse is aware that the success of the rhythm method depends on the age of the client, frequency of intercourse, regularity of the menses, range of the client's temperature. Pause and think of the answer before the reveal. The answer is regularity of the menses. The success of the rhythm method of birth control is dependent on the client's menses being regular. Flashcard 93-114. A client with diabetes asks the nurse for advice regarding methods of birth control. Which method of birth control is most suitable for the client with diabetes? Intrauterine device, oral contraceptives, diaphragm contraceptive sponge. Pause and think of the answer before the reveal. The answer is the best method of birth control for the client with diabetes is the diaphragm. A permanent intrauterine device can cause a continuing inflammatory response in diabetics that should be avoided. Oral contraceptives tend to elevate blood glucose levels, and contraceptive sponges are not good at preventing pregnancy. Flashcard 94-115. The doctor suspects that the client has an ectopic pregnancy. Which symptom is consistent with the diagnosis of ectopic pregnancy? Painless vaginal bleeding, abdominal cramping, throbbing pain in the upper quadrant, sudden stabbing pain in the lower quadrant. Pause and think of the answer before the reveal. The answer is sudden stabbing pain in the lower quadrant. The signs of an ectopic pregnancy are vague until the fallopian tube ruptures. The client will complain of sudden stabbing pain in the lower quadrant that radiates down the leg or up into the chest. Painless vaginal bleeding is a sign of placenta previa. Abdominal cramping is a sign of labor, and throbbing pain in the upper quadrant is not a sign of an ectopic pregnancy. Flashcard 95-117. The client with hyperemesis gravidarum is at risk for developing respiratory alkalosis without dehydration, metabolic acidosis with dehydration, respiratory acidosis without dehydration, metabolic alkalosis with dehydration. Pause and think of the answer before the reveal. The answer is metabolic acidosis with dehydration. The client with hyperemesis has persistent nausea and vomiting. With vomiting comes dehydration. When the client is dehydrated, she will have metabolic acidosis. Answers A and C are incorrect because they are respiratory dehydration. Answer D is incorrect because the client will not be in alkalosis with persistent vomiting. Flashcard 96-109. The nurse is caring for a neonate whose mother is diabetic. The nurse will expect the neonate to be hypoglycemic. Small for gestational age, hypoglycemic. Large for gestational age, hypoglycemic. Large for gestational age, hypoglycemic. Small for gestational age. Pause and think of the answer before the reveal. The answer is hypoglycemic. Large for gestational age. The infant of a diabetic mother is usually large for gestational age. After birth, glucose levels fall rapidly due to the absence of glucose from the mother. Flashcard 97-120. Which of the following instructions should be included in the nurse's teaching regarding oral contraceptives? Weighting should be reported to the physician. An alternate method of birth control is needed when taking antibiotics. If the client misses one or more pills, 2 pills should be taken per day for 1 week. Changes in the menstrual flow should be reported to the physician. Pause and think of the answer before the reveal. The answer is an alternate method of birth control is needed when taking antibiotic. When the client is taking oral contraceptives and begins antibiotics, another method of birth control should be used. Antibiotics decrease the effectiveness of oral contraceptives. Flashcard 98-122. A client is admitted to the labor and delivery unit complaining of vaginal bleeding with very little discomfort. The nurse's first action should be to assess the fetal heart tones, check for cervical dilation, check for firmness of the uterus, obtain a detailed history. Pause and think of the answer before the reveal. The answer is Assess the fetal heart tones. The symptoms of painless vaginal bleeding are consistent with placenta previa. Answers B, C, and D are incorrect. Cervical check for dilation is contraindicated because this can increase the bleeding. Checking for firmness of the uterus can be done, but the first action should be to check the fetal heart tones. Flashword 99-123. A client telephones the emergency room stating that she thinks that she is in labor. The nurse should tell a client that labor has probably begun when her contractions are 2 minutes apart. She has back pain and a bloody discharge. She experiences abdominal pain and frequent urination. Her contractions are 5 minutes apart. Pause and think of the answer before the reveal. The answer is, her contractions are 5 minutes apart. The client should be advised to come to the labor and delivery unit when the contractions are every 5 minutes and consistent. She should also be told to report to the hospital if she experiences rupture of membranes or extreme bleeding. She should not wait until the contractions are every 2 minutes or until she has bloody discharge. Flashcard 100-124. The nurse is teaching a group of prenatal clients about the effects of cigarette smoke on fetal development, which characteristic is associated with babies born to mothers who smoked during pregnancy. Low birth weight, large for gestational age preterm birth, but appropriate size for gestation growth, retardation in weight and length. Pause and think of the answer before the reveal. The answer is low birth weight. Infants of mothers who smoke are often low in birth weight. Infants who are large for gestational age are associated with diabetic mothers, so answer B is incorrect. Preterm births are associated with smoking but not with appropriate size for gestation, making answer C incorrect. Growth retardation is associated with smoking, but this does not affect the infant length. Flashcard 101-125. The physician has ordered an injection of RhoGAM for the postpartum client whose blood type is a negative but whose baby is O positive. To provide postpartum prophylaxis, RhoGAM should be administered within 72 hours of delivery, within 1 week of delivery, within 2 weeks of delivery, within 1 month of delivery. Pause and think of the answer before the reveal. The answer is within 72 hours of delivery. RhoGAM can also be given during pregnancy. Flashcard 100-127. A client is admitted to the labor and delivery unit. The nurse performs a vaginal exam and determines that the client's cervix is 5 centimeters dilated with 75% effacement. Based on the nurse's assessment, the client is in which phase of labor? Active, latent, transition, early. Pause and think of the answer before the reveal. The answer is active. The active phase of labor occurs when the client is dilated 4 to 7 centimeters. The latent or early phase of labor is from 1 centimeters to 3 centimeters in dilation. The transition phase of labor is 8 to 10 centimeters in dilation. Flashcard 103-128. A newborn with narcotic abstinence syndrome is admitted to the nursery. Nursing care of the newborn should include the teaching the mother to provide tactile stimulation, wrapping the newborn snugly in a blanket, placing the newborn in the infant seat, initiating an early infant stimulation program. Pause and think of the answer before the reveal. The answer is wrapping the newborn snugly in a blanket. Flashcard 104-129. A client elects to have epidural anesthesia to relieve the discomfort of labor. Following the initiation of epidural anesthesia, the nurse should give priority to checking for cervical dilation, placing the client in a supine position, checking the client's blood pressure, obtaining a fetal heart rate. Pause and think of the answer before the reveal. The answer is checking the client's blood pressure. Following epidural anesthesia, the client should be checked for hypotension and signs of shock every 5 minutes for 15 minutes. Fetal heart tones should be assessed after the blood pressure is checked. Flashcard 105-131. The elderly client is admitted to the emergency room. Which symptom is the client with a fractured hip most likely to exhibit? Pain, disalignment, cool extremity, absence of pedal pulses. Pause and think of the answer before the reveal. The answer is disalignment. Flashcard 106-133. A 2-year-old is admitted for repair of a fractured femur and is placed in Bryant's traction, which finding by the nurse indicates that the traction is working properly. The infant no longer complains of pain. The buttocks are 15 degrees off the bed. The legs are suspended in the traction. The pins are secured within the pulley. Pause and think of the answer before the reveal. The answer is, the buttocks are 15 degrees off the bed. Skin traction. The infant's hips should be off the bed approximately 15 degrees in Bryant's traction. Flashcard 107-134. A client with a fractured hip has been placed in Buck's traction. Which statement is true regarding balanced skeletal traction? Balanced skeletal traction utilizes a Steinman pin, requires that both legs be secured, utilizes Kirschner wires, is used primarily to heal the fractured hips. Pause and think of the answer before the reveal. The answer is, utilizes a Steinman pin. Balanced skeletal traction uses pins and screws. A Steinman pin goes through large bones and is used to stabilize large bones, such as the femur. Answer B is incorrect because only the effective leg is in traction. Kirschner wires are used to stabilize small bones such as fingers and toes. Flashcard 108-135. The client is admitted for an open reduction internal fixation of a fractured hip. Immediately following surgery, the nurse should give priority to assessing the serum collection drain client's pain, nutritional status, immobilizer. Pause and think of the answer before the reveal. The answer is, serum collection drain. Bleeding is a common complication of orthopedic surgery. The blood collection device should be checked frequently to ensure that the client is not hemorrhaging. An immobilizer is not used. Flashcard 109-136. Which statement made by the family member caring for the client with a percutaneous gastrostomy tube indicates understanding of the nurse's teaching? I must flush the tube with water after feedings and clamp the tube. I must check placement 4 times per day. I will report to the doctor any signs of indigestion. If my father is unable to swallow, I will discontinue the feeding and call the clinic. Pause and think of the answer before the reveal. The answer is, I must flush the tube with water after feedings and clamp the tube. The client's family member should be taught to flush the tube after each feeding and clamp the tube. The placement should be checked before feedings and indigestion can occur with a PEG tube. Flashcard 110-137. The nurse is assessing the client with a total knee replacement 2 hours postoperative. Which information requires notification of the doctor? Bleeding on the dressing is 3 centimeters in diameter. The client has a temperature of 100.6 degrees Fahrenheit. The client's hematocrit is 26%. The urinary output has been 60 during the last 2 hours. Pause and think of the answer before the reveal. The answer is, the client's hematocrit is 26%. Flashcard 111-138. The nurse is caring for the client with a 5-year-old diagnosis of plumbism. Which information in the health history is most likely related to the development of plumbism? The client has traveled out of the country in the last 6 months. The client's parents are skilled stained glass artists. The client lives in a house built in one. The client has several brothers and sisters. Pause and think of the answer before the reveal. The answer is, the client's parents are skilled stained glass artists. Plumbism is lead poisoning. One factor associated with the consumption of lead is eating from pottery made in Central America or Mexico that is unfired. The child lives in a house built after 1976. This is when lead was taken out of paint. And the parents make stained glass as a hobby. Stained glass is put together with lead, which can drop on the work area where the child can consume the lead beads. Flashcard 112-139. A client with a total hip replacement requires special equipment. Which equipment would assist the client with a total hip replacement with activities of daily living? High-seat commode recliner 10s unit abduction pillow. Pause and think of the answer before the reveal. The answer is, a high-seat commode. The equipment that can help with activities of daily living is the high-seat commode. The hip should be kept higher than the knee. The recliner is good because it prevents 90 degrees flexion, but not daily activities. A TENS transcutaneous electrical nerve stimulation unit helps with pain management, and an abduction pillow is used to prevent adduction of the hip and possibly dislocation of the processes. Flashcard 113-140. An elderly client with an abdominal surgery is admitted to the unit following surgery. In anticipation of complications of anesthesia and narcotic administration, the nurse should administer oxygen via nasal cannula, have Narcan naloxone available, prepare to administer blood products, prepare to do cardioresuscitation. Pause and think of the answer before the reveal. The answer is, have Narcan naloxone available. Narcan is the antidote for narcotic overdose. If hypoxia occurs, the client should have oxygen administered by mask, not cannula. Flashcard 114-141, which roommate would be most suitable for the 6-year-old male with a fractured femur in Russell's traction, 16-year-old female with scoliosis, 12-year-old male with a fractured femur, 10-year-old male with sarcoma, 6-year-old male with osteomyelitis. Pause and think of the answer before the reveal. The answer is 12-year-old male with a fractured femur. Flashcard 115-142. A client with osteoarthritis has a prescription for Celebrex celecoxib, which instruction should be included in the discharge teaching. Take the medication with milk. Report chest pain. Remain upright after taking for 30 minutes. Allow 6 weeks for optimal effects. Pause and think of the answer before the reveal. The answer is, report chest pain. COX-2 inhibitors have been associated with heart attacks and strokes. Any changes in cardiac status or signs of a stroke should be reported immediately, along with any changes in bowel or bladder habits, because bleeding has been linked to use of COX-2 inhibitors. Flashcard 116-143. A client with a fractured tibia has a plaster of Paris cast applied to immobilize the fracture. Which action by the nurse indicates understanding of a plaster of Paris cast? The nurse handles the cast with the fingertips, petals the cast, dries the cast with a hair dryer, allows 24 hours before bearing weight. Pause and think of the answer before the reveal. The answer is, allows 24 hours before bearing weight. A plaster of Paris cast takes 24 hours to dry, and the client should not bear weight for 24 hours. The cast should be handled with the palms, not the fingertips, so answer is incorrect. Pateling the cast is covering the end of the cast with cast batting or a sock to prevent skin irritation and flaking of the skin under the cast, making answer B incorrect. The client should be told not to dry the cast with a hair dryer because this causes hot spots and could burn the client. This also causes unequal drying. Flashcard 117-144. The teenager with a fiberglass cast asks the nurse if it will be okay to allow his friends to autograph his cast. Which response would be best? It will be all right for your friends to autograph the cast. Because the cast is made of plaster, autographing can weaken the cast. If they don't use chalk to autograph, it is okay. Autographing or writing on the cast in any form will harm the cast. Pause and think of the answer before the reveal. The answer is, it will be all right for your friends to autograph the cast. Flashcard 118-145. The nurse is assigned to care for the client with a STIM and PN. During PN care, she notes that the LPN uses sterile gloves and Q-tips to clean the PN. Which action should the nurse take at this time? Assisting the LPN with opening sterile packages and peroxide, telling the LPN to clean gloves, or allow telling the LPN that the registered nurse should perform PN care, asking the LPN to clean the weights and pulleys with peroxide. Pause and think of the answer before the reveal. The answer is, assisting the LPN with opening sterile packages and peroxide. The nurse is performing the PN care correctly when she uses sterile gloves and Q-tips. A licensed practical nurse can perform PN care. There is no need to clean the weights, and the nurse can help with opening the packages, but it isn't required. Flashcard 109-146. A child with scoliosis has a speaker cast applied. Which action specific to the speaker cast should be taken? Check the bowel sounds, assess the blood pressure, offer pain medication, check for swelling. Pause and think of the answer before the reveal. The answer is, check the bowel sounds. A body cast or speaker cast extends from the upper abdomen to the knees or below. Bowel sounds should be checked to ensure that the client is not experiencing a paralytic ileus. Flashcard 120-148. The client with a cervical fracture is placed in traction. Which type of traction will be utilized at the time of discharge? Russell's, traction Bucks, traction Halo, traction Crutchfield, Tom traction. Pause and think of the answer before the reveal. The answer is halo traction. Halo traction will be ordered for the client with a cervical fracture. Russell's traction is used for bones of the lower extremities, as is Buck's traction. Crutchfield toms are used while in the hospital and the client is mobile. Flashcard 121-148. A client with a total knee replacement has a CPM, continuous passive motion device, applied during the postoperative period. Which statement made by the nurse indicates understanding of the CPM machine? Use of the CPM will permit the client to ambulate during the therapy. The CPM machine controls should be positioned distal to the site. If the client complains of pain during the therapy, I will turn off the machine and call the doctor. Use of the CPM machine will alleviate the need for physical therapy after the client is discharged. Pause and think of the answer before the reveal. The answer is the CPM machine controls should be positioned distal to the site. The controller for the continuous passive motion device should be placed away from the client. Many clients complain of pain while having treatments with the CPM, so they might turn off the machine. The CPM flexes and extends the leg. The client is in the bed during CPM therapy, so answer is incorrect. Answer C is incorrect because clients will experience pain with the treatment. Use of the CPM does not alleviate the need for physical therapy. Flashcard 122-149. A client with a fractured hip is being taught correct use of the walker. The nurse is aware that the correct use of the walker is achieved if the palms rest lightly on the handles, elbows are flexed 0 degrees. Client walks to the front of the walker. Client carries the walker. Pause and think of the answer before the reveal. The answer is palms rest lightly on the handles. Flashcard 123-150. When assessing a laboring client, the nurse finds a prolapsed cord. The nurse should attempt to replace the cord. Place the client on her left side. Elevate the client's hips. Cover the cord with a dry, sterile gauze. Pause and think of the answer before the reveal. The answer is elevate the client's hips. The client with a prolapsed cord should be treated by elevating the hips and covering the cord with a moist, sterile saline gauze. The nurse should use her fingers to push up on the presenting part until a cesarean section can be performed. Answers A, B, and D are incorrect. The nurse should not attempt to replace the cord. Turn the client on the side or cover with a dry gauze. Flashcard 124-153. The nurse is monitoring the progress of a client in labor, which finding should be reported to the physician immediately. The presence of scant bloody discharge, frequent urination, the presence of green-tinged amniotic fluid, moderate uterine contractions. Pause and think of the answer before the reveal. The answer is the presence of green-tinged amniotic fluid. Green-tinged amniotic fluid is indicative of meconium staining. This finding indicates fetal distress. Flashcard 125. The physician has prescribed NPH insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the peak action of the insulin occurs? I will make sure I eat breakfast within 2 hours of taking my insulin. I will need to carry candy or some form of sugar with me all the time. I will eat a snack around 3 o'clock each afternoon. I can save my dessert from supper for a bedtime snack. Pause and think of the answer before the reveal. The answer is, I will eat a snack around 3 o'clock each afternoon. NPH insulin peaks in 8 minutes, 12 hours, so a snack should be offered at that time. NPH insulin onsets in 90 minutes, 120 minutes, so answer A is incorrect. Answer B is untrue, because NPH insulin is time-released and does not usually cause sudden hypoglycemia. Answer D is incorrect, but the client should eat a bedtime snack. Flashcard 126-154. The nurse is measuring the duration of the client's contractions. Which statement is true regarding the measurement of the duration of contractions? Duration is measured by timing from the beginning of one contraction to the beginning of the next contraction. Duration is measured by timing from the end of one contraction to the beginning of the next contraction. Duration is measured by timing from the beginning of one contraction to the end of the same contraction. Duration is measured by timing from the peak of one contraction to the end of the same contraction. Pause and think of the answer before the reveal. The answer is, duration is measured by timing from the beginning of one contraction to the end of the same contraction. Answer A refers to frequency. Flashcard 127-155. The physician has ordered an intravenous infusion of Pearson for the induction of labor. When caring for the obstetric client receiving intravenous Pearson, the nurse should monitor for maternal hypoglycemia, fetal bradycardia, maternal hyperreflexia, fetal movement. Pause and think of the answer before the reveal. The answer is fetal bradycardia. The client receiving Pearson should be monitored for decelerations. Flashcard 128-156. A client with diabetes visits the prenatal clinic at 28 weeks gestation. Which statement is true regarding insulin needs during pregnancy? Insulin requirements moderate as the pregnancy progresses. A decreased need for insulin occurs during the second trimester. Elevations in human chorionic gonadotrophin decrease the need for insulin. Fetal development depends on adequate insulin regulation. Pause and think of the answer before the reveal. The answer is fetal development depends on adequate insulin regulation. Fetal development depends on adequate nutrition and insulin regulation. Insulin needs increase during the second and third trimesters. Insulin requirements do not moderate as the pregnancy progresses, and elevated human chorionic gonadotrophin elevates insulin needs, not decreases them. Flashcard 129-157. A client in the prenatal clinic is assessed to have a blood pressure of 180/96. The nurse should give priority to providing a calm environment, obtaining a diet history, administering an analgesic, assessing fetal heart tones. Pause and think of the answer before the reveal. The answer is providing a calm environment. A calm environment is needed to prevent seizure activity. Any stimulation can precipitate seizures. Obtaining a diet history should be done later, and administering an analgesic is not indicated because there is no data in the stem to indicate pain. Therefore, answers B and C are incorrect. Assessing the fetal heart tones is important, but this is not the highest priority in this situation. Flashcard 130-158. A primigravida, age 42, is 6 weeks pregnant. Based on the client's age, her infant is at risk for Down syndrome, respiratory distress syndrome, Turner's syndrome, pathological jaundice. Pause and think of the answer before the reveal. The answer is Down syndrome. The client who is age 42 is at risk for fetal anomalies such as Down syndrome and other chromosomal aberrations. Flashcard 131-159. A client with a missed abortion at 29 weeks gestation is admitted to the hospital. The client will most likely be treated with magnesium sulfate, calcium gluconate, dinoprostone, Prostin E, bromocrestine Partal. Pause and think of the answer before the reveal. The answer is dinoprostone, Prostin E. The client with a missed abortion will have induction of labor. Prostin E is a form of prostaglandin used to soften the cervix. Magnesium sulfate is used for preterm labor and preeclampsia. Calcium gluconate is the antidote for magnesium sulfate. Partal is a dopamine receptor stimulant used to treat Parkinson's disease. Flashcard 132-160. A client with preeclampsia has been receiving an infusion containing magnesium sulfate for blood pressure that is 160/80. Deep tendon reflexes are 1+, and the urinary output for the past hour is 100 milliliters. The nurse should continue the infusion of magnesium sulfate while monitoring the client's blood pressure. Stop the infusion of magnesium sulfate and contact the physician. Slow the infusion rate and turn the client on her left side. Administer calcium gluconate IV push and continue to monitor the blood pressure. Pause and think of the answer before the reveal. The answer is continue the infusion of magnesium sulfate while monitoring the client's blood pressure. The client's blood pressure and urinary output are within normal limits. The only alteration from normal is the decreased deep tendon reflexes. The nurse should continue to monitor the blood pressure and check the magnesium level. The therapeutic level is 4.8 to 9.6 milligrams/dl. Flashcard 133-161. Which statement made by the nurse describes the inheritance pattern of autosomal recessive disorders? An affected newborn has unaffected parents. An affected newborn has one affected parent. Affected parents have a 1 in 4 chance of passing on the defective gene. Affected parents have unaffected children who are carriers. Pause and think of the answer before the reveal. The answer is affected parents have a 1 in 4 chance of passing on the defective gene. Autosomal recessive disorders can be passed from the parents to the infant. If both parents pass the trait, the child will get two abnormal genes and the disease results. Parents can also pass the trait to the infant. Flashcard 134-162. A pregnant client, age 32, asks the nurse why her doctor has recommended a serum alpha-fetoprotein. The nurse should explain that the doctor has recommended the test because it is a state law to detect cardiovascular defects because of her age, to detect neurological defects. Pause and think of the answer before the reveal. The answer is to detect neurological defects. Alpha-fetoprotein is a screening test done to detect neural tube defects such as spina bifida. Flashcard 135-164. A client with hypothyroidism asks the nurse if she will still need to take thyroid medication during the pregnancy. The nurse's response is based on the knowledge that there is no need to take thyroid medication because the fetus's thyroid produces a thyroid-stimulating hormone. Regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. It is more difficult to maintain thyroid regulation during pregnancy due to a slowing of metabolism. Fetal growth is arrested if thyroid medication is continued during pregnancy. Pause and think of the answer before the reveal. The answer is regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. During pregnancy, the thyroid gland triples in size. This makes it more difficult to regulate thyroid medication. Flashcard 136-164. The nurse is responsible for performing a neonatal assessment on a full-term infant. At 1 minute, the nurse could expect to find an apical pulse of 100, an absence of tonus, cyanosis of the feet, and hands, jaundice of the skin, and sclera. Pause and think of the answer before the reveal. The answer is cyanosis of the feet and hands. Cyanosis of the feet and hands is acrocinosis. This is a normal finding 1 minute after birth. An apical pulse should be 120 minutes 160, and the baby should have muscle tone. Flashcard 137-165. A client with sickle cell anemia is admitted to the labor and delivery unit during the first phase of labor. The nurse should anticipate the client's need for supplemental oxygen fluid restriction blood transfusion delivery by cesarean section. Pause and think of the answer before the reveal. The answer is supplemental oxygen. Clients with sickle cell crises are treated with heat, hydration, oxygen, and pain relief. Fluids are increased, not decreased. Blood transfusions are usually not required, and the client can be delivered vaginally. Flashcard 138-166. A client with diabetes has an order for ultrasonography. Preparation for an ultrasound includes increasing fluid intake, limiting ambulation, administering an enema, withholding food for 8 hours. Pause and think of the answer before the reveal. The answer is increasing fluid intake. For ultrasonography, the client should be taught to drink plenty of fluids and not void. Flashcard 139-167. An infant who weighs 8 pounds at birth would be expected to weigh how many pounds at 1 year? 14 pounds, 16 pounds, 18 pounds, 24 pounds. Pause and think of the answer before the reveal. The answer is 24 pounds. By 1 year of age, the infant is expected to triple his birth weight. Flashcard 140-168. A pregnant client with a history of alcohol addiction is scheduled for non-stress test. The non-stress test determines the low maturity of the fetus, measures the activity of the fetus, shows the effect of contractions on the fetal heart rate, measures the neurological well-being of the fetus. Pause and think of the answer before the reveal. The answer is measures the activity of the fetus. A non-stress test is done to evaluate periodic movement of the fetus. An oxytocin challenge test shows the effect of contractions on fetal heart rate. Flashcard 141-169. A full-term male has hypospadias. Which statement describes hypospadias? The urethral opening is absent. The urethra opens on the dorsal side of the penis. The penis is shorter than usual. The urethra opens on the ventral side of the penis. Pause and think of the answer before the reveal. The answer is the urethra opens on the dorsal side of the penis. Hypospadias is a congenital abnormality in which the urethral meatus is on the underside of the penis. Flashcard 142-170. A gravidator for 3 Parenteral was admitted to the labor unit. Vaginal exam reveals that the client's cervix is 8 centimeters dilated with complete effacement. The priority nursing diagnosis at this time is alteration in coping related to pain, potential for injury related to precipitate delivery, alteration in elimination related to anesthesia, potential for fluid volume deficit related to nothing by mouth status. Pause and think of the answer before the reveal. The answer is alteration in coping related to pain. Transition is the time during labor when the client loses concentration due to intense contractions. Flashcard 143-171. The client with varicella will most likely have an order for which category of medication? Antibiotics, antipyretics, antivirals, anticoagulants. Pause and think of the answer before the reveal. The answer is antivirals. Varicella is chickenpox. This herpes virus is treated with antiviral medications. The client is not treated with antibiotics or anticoagulants as stated in answers N and D. The client might have a fever before the rash appears, but when the rash appears, the temperature is usually gone. Flashcard 144. Which of the following instructions should be included in the teaching for the client with rheumatoid arthritis? Avoid exercise because it fatigues the joints. Take prescribed anti-inflammatory medications with meals. Alternate hot and cold packs to affected joints. Avoid weight-bearing activity. Pause and think of the answer before the reveal. The answer is take prescribed anti-inflammatory medications with meals. Clients with rheumatoid arthritis should exercise, but not to the point of pain. Alternating hot and cold is not necessary, especially because warm waist soaks are more useful in decreasing pain. Weight-bearing activities, such as walking, are useful, but is not the best answer. Flashcard 145-174. A client with acute pancreatitis is experiencing severe abdominal pain. Which of the following orders should be questioned by the nurse? Meperidine 100 mg intramuscular Q 4 hours as needed, pain Mylanter 30 ccs Q 4 hours, via NG Cyntadine 300 mg by mouth QID. Morphine 8 mg intramuscular Q 4 hours as needed, pain. Pause and think of the answer before the reveal. The answer is morphine. Morphine is contraindicated in clients with gallbladder disease and pancreatitis because morphine causes spasms of the sphincter of Oddi. Meperidine, Mylanter, and Cyntadine are ordered for pancreatitis. Flashcard 146-175. The client is admitted to the chemical dependence unit with an order for continuous observation. The nurse is aware that the doctor has ordered continuous observation because hallucinogenic drugs create both stimulant and depressant effects. Hallucinogenic drugs induce a state of altered perception. Hallucinogenic drugs produce severe respiratory depression. Hallucinogenic drugs induce rapid physical dependence. Pause and think of the answer before the reveal. The answer is hallucinogenic drugs induce a state of altered perception. Flashcard 147-176. A client with a history of abusing barbiturates abruptly stops taking the medication. The nurse should give priority to assessing the client for depression and suicidal ideation, tachycardia and diarrhea, muscle cramping and abdominal pain, tachycardia and euphoric mood. Pause and think of the answer before the reveal. The answer is tachycardia and diarrhea. Barbiturates create a sedative effect. When the client stops taking barbiturates, he will experience tachycardia, diarrhea, and tachypnea. Flashcard 148-177. During the assessment of a laboring client, the nurse notes that the FHT are loudest in the upper right quadrant. The infant is most likely in which position? Right breech presentation, right occipital anterior presentation, left sacral anterior presentation, left occipital transverse presentation. Pause and think of the answer before the reveal. The answer is right breech presentation. If the fetal heart tones are purred in the RUQ, the infant is in a breech presentation. If infant positioned in the right occiput anterior presentation, FHTs will be in the RLQ. If fetus is in the sacral position, FHTs will be in the center of the abdomen. If heard in LLQ, infant likely in left occiput transverse position. Flashcard 149-178. The primary physiological alteration in the development of asthma is bronchiolar inflammation and dyspnea, hypersecretion of abnormally viscous mucus, infectious processes causing mucosal edemospasm of bronchiolar smooth muscle. Pause and think of the answer before the reveal. The answer is spasm of bronchiolar smooth muscle. Asthma is the presence of bronchial spasms. This spasm can be brought on by allergies or anxiety. Flashcard 150-180. To maintain Bryant's traction, the nurse must make certain that the child's hips are resting on the bed with the legs suspended at a right angle to the bed. Hips are slightly elevated above the bed and the legs are suspended at a right angle to the bed. Hips are elevated above the level of the body on a pillow and the legs are suspended parallel to the bed. Hips and legs are flat on the bed with the traction positioned at the foot of the bed. Pause and think of the answer before the reveal. The answer is hips are slightly elevated above the bed and the legs are suspended at a right angle to the bed. Bryant's traction is used for fractured femurs and dislocated hips. The hips should be elevated 15 degrees off the bed. Flashcard 151-182. The client has an order for a trough to be drawn on the client receiving vancomycin. The nurse is aware that the nurse should contact the lab for them to collect the blood of 15 minutes after the infusion, 30 minutes before the infusion, 1 hour after the infusion, 2 hours after the infusion. Pause and think of the answer before the reveal. The answer is 30 minutes before the infusion. A trough level should be drawn 30 minutes before the 3rd or 4th dose. Monitor for increased serum creer and decreased urine output. Flashcard 150-183. The client using a diaphragm should be instructed to refrain from keeping the diaphragm in longer than 4 hours. Keep the diaphragm in a cool location. Have the diaphragm resized if she gains 5 pounds. Have the diaphragm resized if she has any surgery. Pause and think of the answer before the reveal. The answer is keep the diaphragm in a cool location. The client using a diaphragm should keep the diaphragm in a cool location. She should refrain from leaving the diaphragm in longer than 8 hours, not 4 hours. She should have the diaphragm resized when she gains or loses 10 pounds or has abdominal surgery. Flashcard 153-184. The nurse is providing postpartum teaching for a mother planning to breastfeed her infant. Which of the client's statements indicates the need for additional teaching? I'm wearing a support bra. I'm expressing milk from my breast. I'm drinking 4 glasses of fluid during a 24-hour period. While I'm in the shower, I'll allow the water to run over my breasts. Pause and think of the answer before the reveal. The answer is, I'm drinking 4 glasses of fluid during a 24-hour period. Flashcard 154-185. Damage to the Roman 7 cranial nerve results in facial pain, absence of ability to smell, absence of eye movement, tinnitus. Pause and think of the answer before the reveal. The answer is facial pain. Flashcard 155-186. A client is receiving pyridium phenazopyridine hydrochloride for a urinary tract infection. The client should be taught that the medication may cause diarrhea, change the color of her urine, cause mental confusion, cause changes in taste. Pause and think of the answer before the reveal. The answer is change the color of her urine. Clients taking pyridium should be taught that the medication will turn the urine orange or red. Pyridium can also cause a yellowish color to skin and sclera if taken in large doses. Flashcard 156-187. Which of the following tests should be performed before beginning a prescription of Accutane? Check the calcium level, perform a pregnancy test, monitor apical pulse, obtain a creatinine level. Pause and think of the answer before the reveal. The answer is perform a pregnancy test. Accutane is contraindicated for use by pregnant clients because it causes teratogenic effects. Flashcard 157-188. A client with AIDS is taking Zovirax-Acyclovir. Which nursing intervention is most critical during the administration of Acyclovir? limit the client's activity, encourage a high carbohydrate diet, utilize an incentive spirometer to improve respiratory function, encourage fluids. Pause and think of the answer before the reveal. The answer is encourage fluids. Clients taking acyclovir should be encouraged to drink plenty of fluids because renal impairment can occur. Flashword 158-189. A client is admitted for an MRI. The nurse should question the client regarding pregnancy, titanium hip replacement, allergies to antibiotics, inability to move his feet. Pause and think of the answer before the reveal. The answer is pregnancy. Clients with a titanium hip replacement and have an MRI. Flashcard 159-190. The nurse is caring for the client receiving amphotericin B. Which of the following indicates that the client has experienced toxicity to this drug? Changes in vision, nausea, urinary frequency, changes in skin color. Pause and think of the answer before the reveal. The answer is changes in skin color. Clients taking amphotericin B should be monitored for liver, renal, and bone marrow function because this drug is toxic to the kidneys and liver and causes bone marrow suppression. Jaundice is a sign of liver toxicity and is not specific to the use of amphotericin B. Flashword 160. Raynaud's disease. Pause and think of the answer before the reveal. The answer is causes some areas of the body such as fingers and toes to feel numb and cold in response to cold temperatures or stress. In Raynaud's disease, smaller arteries that supply blood to the skin narrow. This limits blood flow to affected areas, which is called vasospasm. Treatment consists of self-care. Treatment beyond self-care, such as dressing warmer, usually isn't needed. Medications and a hypertensive drug and calcium channel blocker. Flashcard 161-193. Cataracts result in opacity of the crystalline lens. Which of the following best explains the functions of the lens? The lens controls stimulation of the retina. The lens orchestrates eye movement. The lens focuses light rays on the retina. The lens magnifies small objects. Pause and think of the answer before the reveal. The answer is the lens focuses light rays on the retina. Flashcard 162-194. A client who has glaucoma is to have miotic eye drops instilled in both eyes. The nurse knows that the purpose of the medication is to anesthetize the cornea, dilate the pupils, constrict the pupils, paralyze the muscles of accommodation. Pause and think of the answer before the reveal. The answer is constrict the pupils. Miotic eye drops constrict the pupil and allow aqueous humor to drain out of the canal of Slim. Mydriatic eye drops dilate the pupil. Flashcard 163-195. A client with a severe corneal ulcer has an order for gentamicin GTT q4 hours and neomycin 1 GTT q4 hours. Which of the following schedules should be used when administering the drops? Allow 5 minutes between the two medications. The medications may be used together. The medications should be separated by a cycloplegic drug. The medications should not be used in the same client. Pause and think of the answer before the reveal. The answer is allow 5 minutes between the two medications. Flashcard 164-202. A client tells the nurse that she is allergic to eggs, dogs, rabbits, and chicken feathers. Which order should the nurse question? TB skin test, rubella vaccine, ELISAR test, chest x-ray. Pause and think of the answer before the reveal. The answer is rubella vaccine. The client who is allergic to dogs, eggs, rabbits, and chicken feathers is most likely allergic to the rubella vaccine. The client who is allergic to neomycin is also at risk. Flashcard 165-203. The physician has prescribed ranitidine Zantac for a client with erosive gastritis. The nurse should administer the medication 30 minutes before meals with each meal in a single dose, at bedtime 60 minutes after meals. Pause and think of the answer before the reveal. The answer is with each meal. Zantac ranitidine is a histamine blocker that should be given with meals for optimal effect, not before meals. Tagamet-cytidine is a histamine blocker that can be given in one dose at bedtime. Flashcard 166-204. A temporary colostomy is performed on the client with colon cancer. The nurse is aware that the proximal end of a double barrel colostomy is the opening on the client's left side, is the opening on the distal end on the client's left side, is the opening on the client's right side, is the opening on the distal right side. Pause and think of the answer before the reveal. The answer is the opening on the client's right side. The proximal end of the double barrel colostomy is the end toward the small intestines. This end is on the client's right side. The distal end is in answers A, B, and D is on the client's left side. Flashcard 167-207. A 6-month-old client is placed on strict bed rest following a hernia repair. Which toy is best suited to the client? Colorful crib mobile handheld electronic games, cars in a plastic container 30-piece jigsaw puzzle. Pause and think of the answer before the reveal. The answer is cars in a plastic container. A 6-month-old is too old for the colorful mobile. He is too young to play with the electronic game or the 30-piece jigsaw puzzle. The best toy for this age is the cars in a plastic container. Flashcard 168-208. The nurse is preparing to discharge a client with a long history of polio. The nurse should tell the client that taking a hot bath will decrease stiffness and spasticity. A schedule of strenuous exercise will improve muscle strength. Rest periods should be scheduled throughout the day. Visual disturbances can be corrected with prescription glasses. Pause and think of the answer before the reveal. The answer is rest periods should be scheduled throughout the day. The client with polio has muscle weakness. Periods of rest throughout the day will conserve the client's energy. A hot bath can cause burns. However, a warm bath would be helpful, so answer is incorrect. Strenuous exercises are not advisable, making answer B incorrect. Visual disturbances are directly associated with polio and cannot be corrected with glasses. Flashcard 169-209. A client on the postpartum unit has a proctoepisiotomy. The nurse should anticipate administering which medication? Dulcolax, suppository docusate, sodium cholase, methagonavine, malate methadone, bromocriptine, sulfate piloidal. Pause and think of the answer before the reveal. The answer is docusate sodium cholase. The client with a protoepisiotomy will need stool softeners such as docusate sodium. Suppositories are given only with an order from the doctor. Methadone is a drug used to contract the uterus. Piloidal is an antiparkinsonian drug. Flashcard 170-210. A client with pancreatic cancer has an infusion of TPN total parenteral nutrition. The doctor has ordered for sliding scale insulin. The most likely explanation for this order is total parenteral nutrition leads to negative nitrogen balance and elevated glucose levels. Total parenteral nutrition cannot be managed with oral hypoglycemics. Total parenteral nutrition is a high glucose solution that often elevates the blood glucose levels. Total parenteral nutrition leads to further pancreatic disease. Pause and think of the answer before the reveal. The answer is total parenteral nutrition is a high glucose solution that often elevates the blood glucose levels. TPN is used to treat negative nitrogen balance. It will not lead to negative nitrogen balance. Total parenteral nutrition can be managed with oral hypoglycemic drugs, but it is difficult to do so. Flashcard 171-211. An adolescent primogravitor who is 10 weeks pregnant attends the anteparal clinic for a first checkup. To develop a teaching plan, the nurse should initially assess the client's knowledge of the signs of preterm labor, the client's feelings about the pregnancy, whether the client was using a method of birth control, the client's thought about future children. Pause and think of the answer before the reveal. The answer is the client's feelings about the pregnancy. The client who is 10 weeks pregnant should be assessed to determine how she feels about the pregnancy. It is too early to discuss preterm labor, too late to discuss whether she was using a method of birth control, and after the client delivers, a discussion of future children should be instituted. Flashcard 172-212. An obstetric client is admitted with dehydration. Which IV fluid would be most appropriate for the client? 0.45 normal saline dextrose 1% in water lactated ringers, dextrose 5% in DOT 45 normal saline. Pause and think of the answer before the reveal. The answer is 0.45 normal saline. The best IV fluid for correction of dehydration is normal saline because it is most like normal serum. Dextrose pulls fluid from the cell. Lactated ringers contains more electrolytes than the client's serum, and dextrose with normal saline will also alter the intracellular fluid. Flashcard 173-213. The physician has ordered a thyroid scan to confirm the diagnosis. Before the procedure, the nurse should assess the client for allergies, bolus the client with IV fluid, tell the client he will be asleep, insert a urinary catheter. Pause and think of the answer before the reveal. The answer is, assess the client for allergies. A thyroid scan uses a dye, so the client should be assessed for allergies to iodine. Flashcard 1-274-2-15. The nurse is caring for a client admitted to the emergency room after a fall. X-rays reveal that the client has several fractured bones in the foot. Which treatment should the nurse anticipate for the fractured foot? Application of a short inclusive speaker cast stabilization with a plaster of Paris cast surgery with Kirschner wire implantation, a gauze dressing only. Pause and think of the answer before the reveal. The answer is stabilization with a plaster of Paris cast. A client with a fractured foot often has a short lead cast applied to stabilize the fracture. A speaker cast is used to stabilize a fractured pelvis or vertebral fracture. Kirschner wires are used to stabilize small bones such as toes, and the client will most likely have a cast or immobilizer. Flashcard 1-275-2-16. A client with bladder cancer is being treated with iridium seed implants. The nurse's discharge teaching should include telling the client to strain, is urine increase, is fluid intake, report urinary frequency, avoid prolonged sitting. Pause and think of the answer before the reveal. The answer is, strain his urine. Iridium seeds can be expelled during urination, so the client should be taught to strain his urine and report to the doctor if any of the seeds are expelled. Flashcard 1-76-2-18. The nurse is preparing a client for cataract surgery. The nurse is aware that the procedure will use mydriatics to facilitate removal miotic medications, such as tomoptic, a laser to smooth and reshape the lens, silicone oil injections into the eyeball. Pause and think of the answer before the reveal. The answer is mydriatics to facilitate removal. Before cataract removal, the client will have mydriatic drops instilled to dilate the pupil. This will facilitate removal of the lens. Miotics constrict the pupil and are not used in cataract clients. Flashcard 177-220. A client with an abdominal cholecystectomy returns from surgery with a Jackson-Pratt drain. The chief purpose of the Jackson-Pratt drain is to prevent the need for dressing changes, reduce edema at the incision, provide for wound drainage, keep the common bile duct open. Pause and think of the answer before the reveal. The answer is provide for wound drainage. Flashcard 178-221. The nurse is performing an initial assessment of a newborn Caucasian male delivered at 32 weeks gestation. The nurse can expect to find the presence of Mongolian spots, scrotal ruby head leg vernix, P-Sozer. Pause and think of the answer before the reveal. The answer is head-leg. The infant who is 32 weeks gestation will not be able to control his head, so head-leg will be present. Mongolian spots are common in African American infants, not Caucasian infants. The client at 32 weeks will have scrotal ruby or redness, but will not have vernix P-Sozer, the cheesy appearing covering found on most full-term infants. Flashcard 179-222. The nurse is caring for a client admitted with multiple trauma. Fractures include the pelvis, femur, and ulnar, which finding should be reported to the physician immediately. Hematuria, muscle spasms, dizziness, nausea. Pause and think of the answer before the reveal. The answer is hematuria. Hematuria in a client with a pelvic fracture can indicate trauma to the bladder or impending bleeding disorders. Flashcard 180-223. A client is brought to the emergency room by the police. He is combative and yells, "I have to get out of here. They are trying to kill me." Which assessment is most likely correct in relation to the statement? The client is experiencing an auditory hallucination. The client is having a delusion of grandeur. The client is experiencing paranoid delusions. The client is intoxicated. Pause and think of the answer before the reveal. The answer is The client is experiencing paranoid delusions. Delusions of grandeur are fixed beliefs that the client is superior or perhaps a famous person. Flashcard 181-227. A client recently started on hemodialysis wants to know how the dialysis will take the place of his kidneys. The nurse's response is based on the knowledge that hemodialysis works by passing water through a dialyzing membrane, eliminating plasma proteins from the blood, lowering the pH by removing non-volatile acids, filtering waste through a dialyzing membrane. Pause and think of the answer before the reveal. The answer is filtering waste through a dialyzing membrane. Flashcard 182-228. During a home visit, a client with AIDS tells the nurse that he has been exposed to measles. Which action by the nurse is most appropriate? Administer an antibiotic, contact the physician for an order for immune globulin, administer an antiviral, tell the client that he should remain in isolation for 2 weeks. Pause and think of the answer before the reveal. The answer is contact the physician for an order for immune globulin. Flashcard 183-230. A client who is admitted with an above-the-knee amputation tells the nurse that his foot hurts and itches, which response by the nurse indicates understanding of phantom limb pain. The pain will go away in a few days. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. The pain is psychological because your foot is no longer there. The pain and itching are due to the infection you had before the surgery. Pause and think of the answer before the reveal. The answer is, the pain is due to peripheral nervous system interruptions. I will get you some pain medication. Pain related to phantom limb syndrome is due to peripheral nervous system interruption. Phantom limb pain can last several months or indefinitely. Phantom limb pain is not psychological. Flashcard 184-231. A client with cancer of the pancreas has undergone a Whipple procedure. The nurse is aware that during the Whipple procedure, the doctor will remove the head of the pancreas, proximal third section of the small intestine, stomach, and duodenum, esophagus, and jejunum. Pause and think of the answer before the reveal. The answer is head of the pancreas. During a Whipple procedure, the head of the pancreas, which is a part of the stomach, the jejunum, and a portion of the stomach, are removed and reanastomosed. Flashcard 185-232. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid eating fruits, salt, pepper, ketchup. Pause and think of the answer before the reveal. The answer is pepper is not processed and contains bacteria. Other answer choices are incorrect because fruits should be cooked or washed and peeled, and salt and ketchup are allowed. Flashcard 186-234. The nurse is assisting the physician with removal of a central venous catheter. To facilitate removal, the nurse should instruct the client to perform the Valsalva maneuver as the catheter is advanced, turn his head to the left side, and hyperextend the neck. Take slow, deep breaths as the catheter is removed, turn his head to the right while maintaining a sniffing position. Pause and think of the answer before the reveal. The answer is perform the Valsalva maneuver as the catheter is advanced. The client who is having a central venous catheter removed should be told to hold his breath and bear down. This prevents air from entering the line. Flashcard 187-235. A client has an order for streptokinase. Before administering the medication, the nurse should assess the client for allergies to pineapples and bananas, a history of streptococcal infections, prior therapy with phenytoin, a history of alcohol abuse. Pause and think of the answer before the reveal. The answer is a history of streptococcal infections. Clients with a history of streptococcal infections could have antibodies that render the streptokinase ineffective. Flashcard 188-236. The nurse is providing discharge teaching for the client with leukemia. The client should be told to avoid using oil or cream-based soaps, flossing between the teeth, the intake of salt, using an electric razor. Pause and think of the answer before the reveal. The answer is flossing between the teeth. The client who is immune suppressed and has bone marrow suppression should be taught not to floss his teeth because platelets are decreased. Using oils and cream-based soaps is allowed, as is eating salt and using an electric razor. Flashcard 189-237. The nurse is changing the ties of the client with a tracheotomy. The safest method of changing the tracheotomy ties is to apply the new tie before removing the old one. Have a helper present. Hold the tracheotomy with the non-dominant hand while removing the old tie. Ask the doctor to suture the tracheostomy in place. Pause and think of the answer before the reveal. The answer is, apply the new tie before removing the old one. The best method and safest way to change the ties of the tracheotomy is to apply the new ones before removing the old ones. Having a helper is good, but the helper might not prevent the client from coughing out the tracheotomy. Holding the tracheotomy with the non-dominant hand while removing the old tie is not the best way to prevent the client from coughing out the tracheotomy. Flashcard 190-238. The nurse is monitoring a client following a lung resection. The hourly output from the chest tube was 300 milliliters. The nurse should give priority to turning the client to the left side, milking the tube to ensure patency, slowing the intravenous infusion, notifying the physician. Pause and think of the answer before the reveal. The answer is, notifying the physician. The output of 300 milliliters is indicative of hemorrhage and should be reported immediately. Milking the tube is done only with an order and will not help in this situation. Flashcard 191-239. The infant is admitted to the unit with tetralogy of Fallot. The nurse would anticipate an order for which medication? Delegation, epinephrine, aminophylline, atropine. Pause and think of the answer before the reveal. The answer is delegation. The infant with tetralogy of Fallot has 5 heart defects. He will be treated with delegation to slow and strengthen the heart. Flashcard 192-240. The nurse is educating the ladies' club and self-breast exam. The nurse is aware that most malignant breast masses occur in the tail of Spence. On the diagram, place an X on the tail of Spence. Pause and think of the answer before the reveal. The answer is, the tail of Spence is located in the upper outer quadrant of the breast. Flashcard 193-241. The toddler is admitted with a cardiac anomaly. The nurse is aware that the infant with a ventricular septal defect will tire, easily grow, normally need more calories, be more susceptible to viral infections. Pause and think of the answer before the reveal. The answer is, tire easily. He will be susceptible to bacterial infection, but he will be no more susceptible to viral infections than other children. Flashcard 194-242. The nurse is monitoring a client with a history of stillborn infants. The nurse is aware that a non-stress test can be ordered for this client to determine lung maturity, measure the fetal activity, show the effect of contractions on fetal heart rate, measure the well-being of the fetus. Pause and think of the answer before the reveal. The answer is, measure the fetal activity. Flashcard 195-243. The nurse is evaluating the client who was admitted 8 hours ago for induction of labor. The following graph is noted on the monitor. Which action should be taken first by the nurse? Instruct the client to perform a vaginal exam, turn off the pitocin infusion, place the client in a semi-Fowler's position. Pause and think of the answer before the reveal. The answer is, turn off the pitocin infusion. The monitor indicates variable decelerations caused by cord compression. If pitocin is infusing, the nurse should turn off the pitocin. Instructing the client to push is incorrect because pushing could increase the decelerations and because the client is 8 centimeters dilated. Performing a vaginal exam should be done after turning off the pitocin. Flashcard 196-244. The nurse notes the following on the ECG monitor. The nurse would evaluate the cardiac arrhythmia as atrial flutter, a sinus rhythm, ventricular tachycardia, atrial fibrillation. Pause and think of the answer before the reveal. The answer is, ventricular tachycardia. Flashcard 197-246. The nurse has a pre-op order to administer Valium-diazepam 10 milligrams and phenytoin promethazine 25 milligrams. The correct method of administering these medications is to administer the medications together in one syringe, administer the medication separately, administer the Valium, wait 5 minutes, and then inject the phenytoin. Question the order because they cannot be given at the same time. Pause and think of the answer before the reveal. The answer is, administer the medication separately. Dalian is an anti-anxiety medication, and Phenergan is used as an antiemetic. Flashcard 198 to 148. Which task should be assigned to the nursing assistant? Placing the client in seclusion, emptying the Foley catheter of the preeclamptic client, feeding the client with dementia, ambulating the client with a fractured hip. Pause and think of the answer before the reveal. The answer is feeding the client with dementia. Of these clients, the one who should be assigned to the care of the nursing assistant is the client with dementia. Only an RN or the physician can place the client in seclusion. The nurse should empty the Foley catheter of the preeclamptic client because the client is unstable. A nurse or physical therapist should ambulate the client with a fractured hip. Flashcard 199 to 150. The physician has ordered a histoplasmosis test for the elderly client. The nurse is aware that histoplasmosis is transmitted to humans by cats, dogs, turtles, birds. Pause and think of the answer before the reveal. The answer is birds. Histoplasmosis is a fungus carried by birds.